So, the topic of today's lecture is mathematical models for exposure assessment. We will first start off by providing some motivation for mathematical modeling in the context of exposure assessment. So, that's the first section. As we may recall, risk is the product of a particular hazard and the probability of the hazard occurring. In other words, it's a function of exposure to a substance and its potency to cause harm. And this has been quantified to some extent by defining the potency of a substance in terms of its exposure limit. It's defined 1 over the exposure limit. So the smaller the exposure limit for a particular hazard, we can assume that it is more potent, meaning more toxic. And so thereby meaning that it takes a very small amount of that hazard to cause harm to us. And we can take the hazard index to be a ratio of the exposure to the exposure limit. And if the hazard index is greater than 1, meaning the exposure is greater than the exposure limit, we can assume that that's a bad situation. And if it's less than 1, it's an okay or possibly even a good situation. And it is very difficult to characterize risk because for 2 reasons. The first one is there are no exposure limits for many things. But that's not the point of today's lecture, but it's an important part of the difficulty of doing risk. But the second part, which is the topic of today's lecture, is that exposure is not very easy to assess, as we have been discussing throughout this course, for a variety of reasons. Exposure assessment is not so easy because we will never measure everything everywhere, because we don't have an unlimited amount of resources and money and time. We cannot measure some things right now because, like I said, we don't have an infinite amount of resources. We may not be able to get into some areas where we may want to make measurements. We cannot measure scenarios if we are not present because they happened elsewhere or they happened in the past. And so we are trying to assess the exposures of somebody that happened in the past, but the health effects are manifesting today. And so we want to know what they might have been exposed to. Our exposures might happen in the future, and we want to design a workplace that can engineer out these exposures or minimize the exposures. So in these situations, we can obviously not make measurements. So can we estimate exposure by understanding the factors that cause exposure? And these factors are also known as the determinants of exposure. And can we understand how these factors or determinants of exposure are quantitatively related to exposure? And the answer that I'm giving you is yes, through mathematical modeling. So let's start off with a basic definition. What is a mathematical model? It is defined very simply as an equation or a set of equations that predicts the behavior of a system given specified values for model parameters. So in our context, a mathematical model is a system of equations that predicts the airborne concentration of a contaminant at different times or at different positions in an environment outside or inside a room. And the model parameters are these exposure determinants that I mentioned in the previous slide. What are the environmental features that could affect the concentration in this room or in this environment? Why do we need to use mathematical modeling? So as I mentioned in one of the previous slides, we may want to estimate exposures prospectively for a process being planned or for an accident scenario. And we may want to design our engineering system such that we can minimize potential exposures in this workplace or in this process or in this accident scenario. We may want to use the results of modeling to select the appropriate respirator that a particular worker might want to use in a given process or in an emergency scenario. We may also use modeling to estimate the exposures of consumers when they are using a particular consumer product. The second reason is to prioritize exposure monitoring efforts. If you recall, in the AIHA strategy, one way to prioritize exposure monitoring, which similar exposure groups should be monitored first, is to use your professional judgment. But another approach is to use mathematical modeling to determine where the monitoring effort should be focused initially. A third bullet is that we may want to use modeling to estimate exposures retrospectively for a process that no longer exists. And we may do that for a legal case where a worker might want to sue a company because he or she was exposed to hazardous substances at a very high level in the past. And so we may want to estimate what that worker was exposed to be a decade or several decades ago. We may want to do this for an epidemiological study where we try to understand the relationship between exposures to some substance over many decades and their health outcomes today.